We have time for a couple of questions.
And I'm now Felicia Chow.
One in the back. Microphone number 1, Dr. Margolick.
Oh, okay. That's very interesting. But the thing I'm trying to wrap my mind around is the fact that many of the factors you're talking about are very interrelated. Stress, depression, housing, isolation. And I'm wondering if you can elaborate or speculate a little more on what's primary and what's secondary as you see it, and also on what data there are that are not cross-sectional and subject to selection biases about interventions that have been evaluated in a randomized fashion that might help to alleviate what the primary factors are.
I mean, just for example of looking at syndemic risk factors, we know from following, let's say, gay men and men who have sex with men, if you're negative and you have these risk factors, your chances of getting HIV go up considerably. And what are those factors? They're depression, they're substance use, there are things that happen early in life, the bullying, the other factor. So I think we know some of those answers already, and I think it's about, the first opportunity in the medical or community-based systems is to be able to ask some questions and to screen for them. People like Heidi Crane, we're involved in some really interesting sort of national collaborations, pooling our data. We're part of the NIH Accord. Heidi Crane's doing some really nice work with PROs and building them into clinics where you ask questions specific to the clinics and the patient populations around the mental health, the substance use, and getting those and screening for them, and then really helping to address those issues as things are underway in terms of their care. So I think we know a lot about what are some of those early things, and I think we need to start sort of backing up the system and not being afraid of sort of asking some questions in a way that's going to help us sort of understand how to manage these issues. It's complex, though. We've started to introduce some questionnaires around intimate partner violence. And it only takes one clinician around the table to say, you know what, I had somebody come back and, they told us about something that, freaked us all out. We didn't have the supports that are there, and we're not going to ask those questions anymore. Those are the questions that actually have to be asked. And those are the things that are going to get at these underlying things that have been going on for some time that put people at risk for HIV and for other negative health outcomes. So I think it's about thinking, informing earlier and be able to use those metrics in very quick ways to track how we're doing. I think our cohort studies really don't have enough of the behavioral measures in them to understand some of those factors. And I think if we did that, we'd learn a lot and we'd know who's at low or higher risk and when we should intervene, right? So those are some thoughts. They're not a complete answer to your question. It's complicated, but I think we should start doing more of it. And certainly, I think in the PrEP world, that's what's happening. It's like how people are getting access to PrEP. Let's decide on who. Right now in Toronto, people go and get tested. You get tested for HIV. You have this, line into care. We're going to follow you. We're going to connect you. If we don't, we're going to get peer navigators. If you test negative, see you later. We'll see. And we don't assess risk. It's crazy, and it's driving me nuts in the city. They should be asked about these questions, and if they, depending on the risk, and there's lots of places that are doing this in the U.S., and deciding then what is the treatment arm or what is the interventions or what are the opportunities that we should make available to these people to change that risk or change that trajectory that you're going on. If you keep going on that trajectory, things are not going to turn out so well. So I think it's about thinking about, this for me is what implementation science or the pragmatics of sort of program science are all about, and I think it's a helpful context to think about.
So we have time for one more brief question.
Sorry, that was a long answer.
If not, I think we ought to move along, but thank you, Sean.
Pleasure.
Great talk.